Yes, in the first video, I did promise to make a second video concerning healthcare workers' right to industrial action. And I did promise that I would give them a solution that will not be disrupting the activities in the public hospitals. Yes, because of Section 45, Subsection 2 of the National Health Act, which prevents them from, disrupting activities in the health institutions. And also, I did mention Section 31, Subsection 6 of the Trade Union Act, which forbids people under essential service, essential services from embarking on strike. And I also did mention that Section 48, Subsection 1 of the Trade Disputes Act, which equally defines what essential service is all about. And the first schedule of the same Trade Disputes Act, which listed professions under essential services. So now we want to get the simple solution. Now, before giving the solution, I want to tell a small story. That story is about a town. There's this town, there was a strong man in that town. And that man had money, connections, whatever you could think about. Now, this man, if anybody talks in the village, this man would arrest that person, put the person in a cell, from there to prison, anything he wants. So he had the connection. So do you know what the villagers did, the community members? They gathered and had a meeting and said, for now, this man, nobody could challenge this man in all ramifications. See what we do. That we can also get another simple solution. What did they do? They said, okay. Now, what they did, they said nobody in that town should have any relationship with the man. The family could not go to the market to buy anything. No relationship. Don't visit him. Let him not visit. No, nothing. No contact. If he comes inside church, everybody will depart the church, since you cannot pursue him from the church. So the man said, no problem. That's not an issue. Now, one day, the daughter of that man was wedding. Normally the weddings normally occur in people's ancestral homes. So now this man invited guests from all parts of the world. These people came. When guests are going to places like that, guests will be asking questions to the villagers. Please, do you know Mr. A's house? Anybody they ask, the person will put mouth, cover his mouth and be running. Nobody wants to talk to anything involving me. That man. At the end of the day, what happened? Do you know that along the line, things came up and all those stuff? At the end of the day, it was a huge embarrassment to the man, because some of the invitees went to the man and asked him question, "Oga, what is happening? Why is it that once your name is mentioned, everybody's running away?" So they began to see that man that, look, this man might be a bad man, because people that knew him better, these people, you see, you have a wedding, nobody from the village attended. Nobody, except those people invited from other places. So after that, the man had to go to the community leaders, pleaded with them, and did the restitution. And at the end of the day, the man was forgiven and the people began to communicate with him. So you see, what the villagers could not achieve through courts or through police, through money and whatever, they achieve it by a simple method. So now that is the method I want to give to the people in the health sector. Now, instead of disrupting services, because we are all humans, we should have conscience. Yes, I know that the working condition is bad, the salaries paid are very meager, and so on and so forth. But let's listen to this. Bible say, go to the ants and learn wisdom. Now let us go to the smallest set of doctors. For instance, over the years, I've watched them, I've learned a lot of things. We have these people we call locum doctors. They are found in different states. They form different unions and so on and so forth. Let me not call in anyone in particular. Now, these people are so strong. What do? If a doctor is hired temporarily to work in a hospital, he goes to the hospital, and at the end of the day, the owner of the hospital refuses to treat the doctor well or pay the salary that they agreed. Do you know what the the doctor will do. The doctor will not fight the person. The doctor will not shut down the hospital. The doctor will just go to the platform and write, this hospital I worked, this is what we agreed, but he refused to pay me. They will blacklist that hospital. What it means is that hospital can no longer get any doctor. Because most times, some of them, before going to work there, what would they do? They will ask the question, say, let's assume if there's an advert, somebody on the platform who is interested in the advert will write, please, is there anybody that has knowledge of this hospital? Somebody will say, that place, no go area, or no go there. If you go there, that man, they para. So you see, this small set of doctors, they are achieving what the bigger doctors could not achieve. One, they are not taxing their members financially. Like I know that most of the, like let me use doctors for instance, some of the affiliates and even NMA go ahead to deduct monthly dues of their members at source. With the little salary paid to their members, they still go there and withdraw. And not even that, monthly, and not even that, they still have the infantry that if there's any special project, they will have meeting, whatever, congress or whatever, before you know it, they will tax. They will tax extra money on the one they're already collecting, like 20,000 naira per month or whatever. So, but at the end of the day, the pattern they are using to get better working conditions, remunerations for their workers, some of those methods are now, a cake. So because of that, we learn from those local doctors. They are not going to court. They don't cause industrial action. They don't even make noise. They don't do anything. What they do is just very simple thing. So once a hospital goes against their rule or even publishes an advert and the amount they put is, they fix their own amount. Imagine, without going to salaries, whatever commission, you understand? They fix the amount. This is what a doctor should be paid per hour. This is what a doctor should be paid for 1 day coverage. This is what a doctor should be paid for 1 week coverage. Now, if you put an advert in their platforms and the thing goes below their expectation, they will buy you from there, possibly for life, possibly for 1 month, depending on how that set, how they want it to be. You understand? So it now makes people, because I know I've interacted with a lot of hospital owners. You understand? Those hospital owners, they will tell you, I don't want to fall into their trap. So if a local doctor is coming to work for you, you already prepare his money and keep. But if I put it in an envelope so that you don't want to say, I want to transfer and the network was bad, really you transferred, but it's one. You understand? So you see, these men are achieving the collective objective of unionism without taxing anybody, without withdrawing their members' salaries or annual dues or monthly dues at source. So I want to introduce this method to all health workers, the doctors, the lab scientists, the pharmacists, the nurses, the physiotherapists, all of them. Apply this method. What is that method? When you make a demand and the hospital refuses to achieve that demand, or the hospital refuses to do that which is right, what do? Very simple. You just call everybody. A few people will agree, and there is no greed, because this method will not work if there is greed. Now let everybody come together and resign. If everybody resigns and nobody goes to the back to go and take up, like the one that happened when NAD went on strike, Nigerian Association of Resident Doctors went on strike, UPTH chapter, said they are not going to join. You understand? If they will be united, all doctors will resign. Boom. When all doctors resign now and nobody is ready to take up any job, there will be civil unrest. When there is civil unrest, the government will be forced. This is no longer, Ogashebi, we don't leave your job. Fine. Oh yeah. You want us to come back? We ask you to bring MRI, working MRI. We want you to bring this. I've shown you people that in Section 20 of the National Health Act, nothing prevents you from administering emergency medical treatment to a patient that is classified under emergency patient. Nothing. You cannot even tell the person that there is no bed space. Yes, it's not your duty to provide bed space, but the law will catch up with you. There are some cases which I cited, watch my previous videos. So I think with this formula, then you will achieve everything you want to achieve. Do you know what? Even some artisans are doing it. Some artisans, when you come to call them, like I know one in Port Harcourt, when you want to call them, they will tell you their day pay is 15,000. That 15,000, you say, okay, let's go now, but you never see what you want. You say, no, you pay that 15,000 before they leave here. And because most of the youths are no longer going into all those menial jobs like carpentry, medicine job, and so on and so forth, now we have few number of people. Thank God. The same thing in the health sector. Everybody is emigrating. Everybody is leaving the country. We have fewer people. If you are united and know your worth, you know your worth is a very simple thing. Then you see you can, who at this time, we are going to hold the government without this. Just, I know the work again. There's no law that says, the only thing is that you need to give the government ample time to say, no, I am leaving. And also remember, for the doctors, Section 45 of the Code of Medical Ethics, at times when doctors want to go on strike, they will write to the government. The Code of Section 45, Subsection 1 of the Code of Medical Ethics, yes, acknowledging your right to strike anyway, you understand, equally states that you should also write to the patient, that patient under your unit. You should inform them that, look, this treatment we are doing, so time, we are going to stop our work. So start making an arrangement. You don't just come in the morning. The way we normally do it, you just come in the morning and write referral note. The patient, where does he know that he's going to? So watch, make sure that you like, share, and comment for others to learn so that they can see the next video I'm going to drop. Thank you.